Hey, good morning. Welcome. And thank you for listening to WHLI this morning, Health Talk Radio. I'm Dr. Victor Politi, the President and CEO of NuHealth. That's Nassau University Medical Center on Hempstead Turnpike in East Meadow. So as healthcare in America is changing, NuHealth is part of that change. This half-hour program will provide you with some essential information about our services and facilities that provide top-quality care that fits into your lifestyle. NuHealth's roots go deep into Long Island's history. What began in 1935 as a 200-bed general hospital has now become part of a unique health organization with multiple centers of care and a commitment to deliver excellent, essential care to everyone at every stage of life. We're absolutely dedicated to being the healthcare institution that makes the full spectrum of world-class services available to all of Nassau County residents. Our improvements are making us a leading provider of primary and tertiary care services that rival the best in the country. So, thank you for listening. We appreciate you being here. We have a guest today who's really going to be interesting. She's from our emergency department at Nassau University Medical Center, and that's Dr. Grace Ting. So, good morning, Dr. Ting. How are you?
Good morning, Dr. Politi. I'm fine.
Thank you for being here today.
Thank you.
So, Dr. Ting, why don't you tell me a little bit about yourself, where you went to medical school and residency, and what you do at Nassau University Medical Center?
Okay. I went to medical school at SUNY Buffalo, and after that, I did my residency at St. Luke's Roosevelt in New York City. And after that, I came to the medical center as an attending physician in the emergency department. And I've been there for over 25 years.
Wow, 20. So you've seen the ER. Actually, you've seen the whole hospital change completely over those years, haven't you?
Yes, I have. The emergency room that started in the ground floor as different compartmentalized different areas, and patients piled on top of each other. And 4 years ago, we moved into the new emergency department.
That's a beautiful area now. I think it's like $38 million renovation, state of the art, brand new.
Yes. And
yeah,
single rooms.
Single rooms. So every patient there's not curtains between the beds. You're actually in individual rooms.
Correct. I
understand they have color television, flat screen TVs in every room too. Is that correct?
Correct.
Really. So you have beautiful isolated rooms, privacy, TV, glass doors on the front.
True.
How about the staff? How's the staff at the NUMC, at the emergency department?
Staff are very, caring and very efficient, and they're there because they like to care for the patients.
You have all board certified docs.
Yes.
All emergency medicine people.
Right.
You have a residency now, so you're training young emergency medicine doctors. So it's a training institution. People like that when it's not only you have attendings are professors, and they're training, new residents. Really adds to a great environment, a teaching environment.
Yes, we're very proud to start our emergency medicine residency this year, and this is our first group, and they're working very hard.
So you have an adult ER. Do you have a peds ER as well?
There's a pediatric ER, yes.
And you have peds ER attendings. You have a pediatrician in that.
We have pediatricians and attendings board certified in pediatric emergency medicine.
So when you come to the hospital with a child, not only are you coming to the emergency department that has full service of services like CAT scans and sonograms and everything else you might need, but your child is actually being seen by a pediatrician that specializes in kids, and that's so important. I mean, hey, look, all doctors are good. ER doctors especially trained in everything. They're like, they do trauma, they do OBGYN, they do peds. But it's nice to know that you have, some pediatrician standing there just in case we need them.
Yes, we do.
So, I mean, you see a lot of talk today, and you see a lot. You can't drive anywhere today without seeing these urgent care centers popping up all over the place. So, and they're great, and they serve a purpose. And the reason a lot of people go there because they're quick and they get in, they get out. What are you doing at your hospital so that patients, when they arrive, they don't wait? They come in, they get seen, and they get, and they get their medication if they need it, and they get on their way.
Yeah, we have a Fasttrack area that's basically for ambulatory patients that could go to urgent care centers, and we do see them away from the main emergency department, and then we try to get them in and out very fast.
So just like urgent care center.
Sure.
So patient comes in, says, listen, I have an earache or a sore throat or a minor laceration. You don't even
Yes,
have to
they
bring them
can.
into the main ER with the heart
No.
attacks and the strokes and all the other stuff.
No.
You have a separate fast track area with a physician and PAs that will see this person
True.
and treat them rapidly,
Right.
in and out.
Right.
That's
Correct.
Because I think it's
Correct.
important that people know that urgent care centers are great and they serve the purpose. But if it's something more,
Right.
they're not going to have that resource. I mean, if you need
Right.
an orthopedic surgeon or a plastic surgeon
Right.
or a neurologist,
Right.
you call up and they come down.
Right. You
Uh,
can still do that from the fast track area.
Mhm.
Or if you're really sick and you can, be bumped up to the emergency room, to the main emergency room instead of being transferred to a hospital.
Right. So that musculoskeletal pain that you felt in your chest after raking leaves turns out not to be just musculoskeletal, but really it was maybe something we're concerned about with your heart.
True.
You could just move them next door into the emergency
True.
department, and
True.
you have the full service of
True.
cardiology and
True.
echocardiograms, and even we have cath lab, cardiac catheterization if you might need it. So people don't know. They think it's something because. Yeah, you tell me. I mean, every day we're getting patients taken from urgent care centers by ambulances to our emergency
To our
department.
emergency room, yes, yes. And also the doctors and the physician assistant that works in the fast track area also works in the main emergency room.
So they're
They're aware of all the difficult and all the serious diseases
Right.
also.
Right. So,
Yeah.
and that's important, because I know a lot of times people go to these urgent care centers, and then the urgent care center says, "Oh no, listen, that feeling that you're having is a stroke or it's a heart attack or it's something's really damaged here," and they send them by ambulance to the hospital, and then
Sure.
and that's what we have. We're there. We're I mean, I'm very
Right.
proud of our emergency room. I mean, I think the doctors there are amazing doctors, and nurses are really amazing. All the ancillary staff, from the housekeeping to the PCAs to respiratory therapy to the X-ray techs, the CAT scan techs. I mean, you actually have one of the most powerful CAT scans in your emergency department. One of the strongest CAT scans that's made in Nassau County in your ER.
Right. It's the state of the art.
There you go. Was it 300
320.
320 slice CAT scan?
Right.
You can actually take a CAT scan of a beating heart and see blockages in the heart.
Right. Correct.
That's amazing. Have you incorporated that now into the protocols? Have you been doing CAT scan?
We're working with cardiology, try to come up with a protocol to incorporate that.
Because that's really ahead of the game. That's not many ERs are anywhere near that,
Right.
especially having that level of a CAT scan available to do that, and giving us some really clear pictures of coronary arteries to see what's
Right.
going on in there.
Right.
So I mean, the hospital is a level 1 trauma, and you ask any fireman or any police officer or ambulance technician, they're going to tell you if there's a trauma, they're going to NuMec. They know you guys have 2 critical care areas, 1 operating room ready to go. I mean, in the emergency department, you guys really are ready to go with trauma, and you have some of the top trauma surgeons, 24 hours a day, 7 days a week, physically present in that hospital. So if there is a trauma, you're getting, really top docs coming right down to that ER with you, with the emergency room doctors
That's
to work
right.
on that patient.
Yeah, that's right. I think ever since I've been at the medical center, we've always been known as the trauma hospital, and I think that's true. And we do see everything.
Yeah, I mean, we have 2 heliports. I mean, this morning I was a little late getting here because I couldn't move my car out of the hospital because the helicopter landed in the heliport. And when the helicopter's there, they don't let anyone drive around that area because the helicopters.
Right.
So, I mean, they had a major trauma there this morning. And
Right.
You really do God's work because you have really great success with some really, severely damaged people. You guys are amazing.
Well, thank you. You're part of it too.
Yes, thank you very much. You have things, other things people don't, plastic surgeons. You have Long Island Plastic Surgical Group is in the hospital itself. And they're one of the top plastic surgical groups in the county. And we're not talking about getting your facelift or Botox. We're talking, God forbid, a young lady or a young child gets a cut or a laceration or something. We're good at it. ER docs are good at it.
Right.
But you can call down a plastic surgeon to suture that child.
Right.
And what's better than having a plastic surgeon available?
Right.
And,
Right.
And they have double duty, right? Don't they do our burn center?
They do the burns. They do the hand injuries. Yes.
So tell me about the burn center.
Well, the burn center is the only burn center on Long Island, right? And they have, beds for the most severely burned patients.
Mm-hmm.
And you know more about it than I would.
I know, but you're my guest, and
I
you've been there
do.
25 years, so I love hearing everyone's
I do, and all the all the police and
Yeah.
police officers, or and we get people from Queens,
Mm-hmm.
transferred to us for
Yeah.
evaluation for the burns.
Yeah, I see the New York City Fire Department.
Right.
New York City Fire Department ambulances are at the hospital all the time
Right.
with patients.
Right.
So I mean, so it's the only burn center I think in Nassau County. It's
Right.
a separate sterile area with really beautiful rooms.
Sure.
They have those hydro baths
Right.
at there, and the firefighters from Nassau County sort of adopted it. It's their burn
Right.
center. It's the Nassau County
Right.
Burn Center.
Right.
They have golf outings and dinners to help support it,
Sure.
and they have all their plaques up there on the wall of all the different firemen that we help. But it's
Yeah.
not just for firemen; it's for
No, it's for
anyone.
everybody.
Anybody who's in a fire or burnt.
Right.
I just got this morning. There's a lot of things happened this morning. A letter from a husband of a woman that was burnt severely, and she had a fully circumferential burn around her wrist, which was swelling and could have actually cut off the circulation to the hand, and came to you in the ER, and you guys diagnosed it, did what you had to do, and went to the burn unit, and the burn fellow, the burn doctors, we have specific doctors that are doing the burn
True.
fellowship,
Right.
did an amazing work with her and saved her hand.
Right.
And I just got a letter from that husband today, thanking the hospital and doctors, Dr.
Right.
Rena and the other doctors from Long Island Plastic Surgical Group that
Right.
worked on his wife. So, I mean,
And-
it is an amazing place.
Right, and also associated with that is a hyperbaric
Oh yeah, what's
center that's for wound treatments,
that? Okay.
for the burns, for the carbon monoxide. I
Mhm.
think we're the only one on Long Island that has a multi-place chamber where you
Yeah.
have multiple patients that goes in there to get
Yeah,
treated at the
that's
same
true.
time.
The only other one
Yeah.
I think is up in Jacoby in the Bronx.
Right.
So the hyperbaric chamber, it looks like a small submarine, right?
It
They
is
put
a
like
small
6 or 8
submarine.
people inside into the hyperbaric. So if you have, for example, we have a carbon monoxide leak in a house, and we have a family that has overcome by carbon monoxide, and they
Right.
come to you in the emergency room. You give them oxygen, you stabilize them, you draw the blood test, you get the X-ray, you get all the stuff, and you realize, hey, this guy's carbon monoxide level is carboxyhemoglobin is very high. He needs hyperbarics. You can put
Right.
the whole family
True.
or the whole squad from the firehouse at the same time in that
Into the
hyperbaric,
chamber
and they can
treat
get
it.
chamber and dive, or if someone's in a stretcher, you can put the stretcher in there if they can't get up and
Right.
dive that person for
Right.
hyperbarics, for smoke inhalation, for
Right.
carbon monoxide, or for diving injuries.
Right.
I know helicopters bring Dan Network, the diver network.
Right,
The
they
helicopters,
do.
if they have someone who have a diving injury
decompression.
anywhere in this
Right.
northeast area, they helicopter them in to us so we could give them treatments.
True. True.
And then we have the other ones, the regular tube hyperbarics. And
Sure.
that's what we do with wound care,
Sure.
for people who have really bad ulcers,
Sure.
diabetic foot ulcers, podiatry stuff. And we have those types of wound care treatment hyperbarics as well.
Yep.
I mean,
Yes, we
you're
do.
just telling me so much about this hospital. I mean, it really is an amazing place. I mean, I've been the CEO there now for a year and a half, and I am so proud of that hospital. First of all, it's not just the ER, but the hospital in general. I've never seen a cleaner hospital in my life. I mean, those housekeepers work tirelessly. I mean, you can comb your hair on the floor. It's shiny. That's how shiny it is. I walk in,
Yes.
it amazes me.
Yes, yes, and I've seen it's not always it is,
Yeah.
but in the past few years, it's really came a long way.
Amazing.
It really.
I mean, every night the carpenters and the plumbers and the painters are in there. They pick a
Sure,
room
they're
a night and they
painting.
redo a room and they put
Yes.
down, they paint it, new curtains, a flat screen TV. So that
Yep.
little by little, the whole face of Nassau University Medical Center, the reputation of it being an old county hospital from 1999, is changing. It's now
Right.
no longer that county hospital. Now we're really a competitor. Look, Nassau County has some great hospitals, and we are really blessed. Anybody who lives in Nassau County, we're blessed with the finest police department in the world, the finest fire departments in the world, the best equipment to save our lives. And, we have some great hospitals. Look, North Shore, LIJ, what a great system they are. Winthrop, fantastic. South Nassau, fantastic hospitals. The Catholic Health Services Hospital, St. Francis, great hospitals in Nassau County. And then you have us. We're NUMIC, and we're right in the center of the hospital, and we're the trauma guy and the burn guy, and we have hyperbarics, and we have pediatricians, we have the labor and delivery. But you know what? We're now becoming one of those hospitals. We're becoming a world-class facility. We're going to really be right up there ranked with those other hospitals, so that when patients do come to us, then they see an immaculately clean hospital, board certified doctors like yourself, Dr. Ting, who I have to honestly say has one of the nicest personalities. Everyone talks about you all the time about
Thank you.
and that's why you're here because you really, I mean, all the docs, all the patients always say how nice you are, how you go out of your way to help someone, and that's for a child, an adult, or even someone. You know, I just witnessed you with a person who had a substance abuse problem. Had a real bad substance abuse problem. He was coming down off of something. He was arrogant. He was screaming. He really was mean and nasty to everyone. But you walked in there, and I watched you talk to this guy and calm him down, and offer him help as you would anyone else. And were able to talk him into staying into the hospital to get into a drug treatment program. I mean, I saw that. I said, wow, what a doctor. I said, it goes beyond you being board certified and all the ER stuff that you do. To just the type of person that you are, and I mean, I'm so proud to work next to doctors like you out in that hospital. Really
Well, thank you very much.
Yeah, it's true. And there's so many stories like that in that hospital, and people don't realize it. Our labor and delivery we opened up, amazing. You think you're in a fancy hotel.
Right.
Those rooms
That's
are
right.
really that nice.
That's right.
And we've had some famous people come to the hospital just to see it, and decided to deliver their children or their child in our hospital. I'm not going to mention any names, but some really famous people have come in and said, wow, this is really the nicest hospital, delivery room, the nicest hospital obstetrical area, labor and delivery area that I've ever seen. I want to deliver my baby here at this hospital.
True. True.
So what else is happening? Tell us some more about the ER. What other special stuff do you guys do down there?
Another thing that I'm involved with is actually I'm the medical director for our sexual assault program. I would say we see probably all the children with suspected sexual abuse or child abuse that comes, into our ER. We're also a center of excellence for sexual assault, and our program has really boomed. And if you come in, we get called. We have people on call 24/7, and one of the examiner comes in within the hour to take care of you, and then get you hooked up with any kind of social services that you need, with the Coalition for Domestic Violence and Sexual Abuse, and with the any of the clinics that needs to be done. Yeah.
That's some of the things, ER, and you talk about doctor and all the great things that help people, but we do see this other side of the world. We do see this other part, and we don't like to talk about it. We don't like to publicize the substance abuse or the domestic violence or the child abuse, but it's out there and it occurs. And you have what they call a sane and safe program.
We have a SAFE program, right?
What does that stand for?
Sexual assault forensic examiner program,
And
or SANE is the nurse part.
The nurse examiner, sexual assault nurse examiner.
Right.
And these are certified specialists in dealing with just these types of disasters.
True. Yeah.
So domestic violence, they come, they can see you. They're not put into the general emergency room area. They're in a quiet area by themselves in the back.
Right. We have special suites that we do the examination, and we have a great relationship with the coalition and also the police, the special victims.
Special victims, And so you'll be able to talk to them and make sure their medical needs are taken care of first, and then work on some of the emotional and psychological issues that affect these people. Because it is a horrible thing when something happens, especially sexual abuse of a child or something along those things.
Right.
I mean, I know that there are very few hospitals that have that service available. And I know the police bring a lot of the victims to us, so that we could work with them and do what we can for them. So that's an amazing, the thing that you gave your heart and soul to. And I know you have a couple of really talented nurses that work with you and other physicians that really taking this to heart.
Right. Actually, the director of the program is Barbara. She's a nurse practitioner. She's been doing this for over 20 years. So very experienced.
Right.
Yeah.
These are people in their worst that really need help.
Right.
Amazing. So, I mean, you're doing that. You have the PEDS ER, you have the trauma bay, you have so many other things going on. Tell me some other interesting facts.
And the other interesting facts? I don't know. We do. I'm basically involved with the operations, trying to get the people. Patients comes in and try to get them to be seen faster.
So you're looking
Yeah,
at the
and
flow.
operate at the flow.
So you're trying to
Right.
make sure everything. So you're on top of that, making sure you have enough doctors, enough
Right.
nurses, enough stretches, enough wheelchairs, all
Well-
that type of stuff to keep things moving.
Right, and also, get the patients upstairs faster if they're admitted.
Admitted, that's important.
Yes.
Yeah, you don't want to be sitting around that ER.
Right.
Although those
Right.
rooms are comfortable. Those beds
They
are
are very
comfortable and they're
comfortable.
quiet and they have
Right.
TV, so they
Right.
could actually board there if they had to, right?
Right.
So-
Well, very few.
So last year, I think it was last year, or maybe the year before, all of a sudden there was this Ebola scare, all right?
Mm-hmm.
And next thing I know, you guys are constructing something downstairs. What's that whole area?
That's it. Our infectious disease room. It can hold Ebola patients. It's to that standard, and it can hold not only Ebola patients, any other patients that has communicable diseases that are very contagious. So we can actually open that room and put the patients in there and use that room.
Yeah, sure. I mean,
Yeah.
there's all these other really highly contagious
Contagious.
MERS, Middle
Right.
Eastern respiratory syndrome,
Right.
and you have SARS, all these different viruses and heavily
Right.
contagious diseases.
Right.
So they don't even come into the hospital, right? They don't come into
They
the
don't
ER.
come to the emergency room. They can go straight downstairs.
So in the ground floor.
Mhm.
And it's a big shower. If someone has
Yes.
back in there around 9/11, they were talking about anthrax and sarin gas and that type. So they have showers they could decon, do a
Right.
full decontamination, and then you have negative pressure rooms that have filtered air.
Right.
So these patients can go in there, and you have all the equipment to make people look like spacemen with those moon suits, right? And the
Right.
Scott packs on their back, the confined
Right.
scuba packs,
Right.
and
It's
it's all standing by, ready to go.
Right. It is ready to go.
Yeah.
And all the equipment's there.
Now, there's a red trailer out in the parking lot right next to that. What is that red trailer?
The red trailer is that the decon shower.
Decon shower.
Decon shower for any massive chemical incidents.
Right, so if there's a
Yeah.
massive type of exposure, you guys have
Right.
this tractor trailer full of
Right.
showers that people can just be deconned from.
Right.
And you have heliports, and you have all sorts of extra precautionary rooms for patients that might have some sort of illnesses.
That's
So
true.
It really is an amazing hospital that we have right here on Hempstead
That's true.
Turnpike. And what's the new primary care center is opening now too? I see all that construction.
I guess so.
guess
you
so.
you tell me. We're anxiously awaiting. Yes.
Well, that's a $24 million, I believe it is, renovation
Mm-hmm.
on the ground floor, on the first floor actually, when you come in. That's going to be brand new, hopefully opening up by the end of the year. That'll have OB services in it, OBGYN, pediatrics, and medicine. So, for example, medicine will have all the medical primary care services. You'll have cardiology, pulmonary, you have allergy and immunology, all the different primary care services right there, so that your patients, when they get discharged from the emergency room or from the hospital and they need to follow up, they can make one-stop shopping. They come in, they make an appointment, we'll make the appointment for them before they leave. You can make the appointments from the emergency room
That's right.
for the next day to have someone come in for whatever the ailment might be, and be treated by the by the doctors.
I know. And you have the drugstore right there.
Yeah, right.
For
we
the
have-
medications.
we opened up a Walgreens
That's
in the
right.
hospital, right?
Right.
So patients, if they need medication,
It's
they
right
get it
there.
right there as well. And there's a bank. If you don't have enough money, there's a Bethpage Federal Credit Union. Take out some money and go to the Walgreens. It is. People don't think about that when they see a hospital. About that it is like a little city amongst itself.
It is.
We have 3,500 people, just about, that work at Nassau University Medical. It's a huge
Right.
operation
It is.
that bring a lot of people in the community, a lot of jobs, and these are people that live here in Nassau County that work here,
Right.
and they really care about their community.
True. True. And we have medical control. Right,
All
right
right.
in the hospital also.
What is that?
Nassau County. That's Nassau County Medical Control. I think the 911 system for the police, with the ambulance, emergency ambulance unit.
So all
So-
the ambulances, the fire department, police, all the ambulances that respond to a call, they get on their radio and they talk to you. They talk to medical
They-
control.
Yes, and they patch up. If they have any questions, if they need any medications, they patch them up to the emergency department.
And then you talk
the
to them.
attending, right.
So we have in the hospital an area which is called telemetry control with all the radios from all the ambulances and fire trucks and police ambulances and helicopters, and any medical issues they can talk directly to us at Medcom,
True.
and then they transfer it up to the emergency room to you guys, and then you can actually give a doctor to paramedic talk or doctor to EMT talk, and talk them through a procedure or talk them through a medication administration or something like that.
Yeah, we do that all the time.
And you also have the training center there too, right? There's also
The Fire Police Academy, right?
the Nassau County Fire Police Academy is located in Newmick as well.
True.
What do they do there?
They teach medics. They teach paramedics and EMS providers.
So they have classes
So,
there continuously?
classes. Yep.
So if anybody wants to become an EMT, emergency medical technician, right, or a paramedic, or they need a CPR or ACLS, they have that at the hospital. They have that in the Fire Police Academy.
Right.
Yeah, it's that's great
Right.
too. So it really has everything that we might need in one spot right there for healthcare in Nassau County, and it's in a nice footprint here in East Meadow.
Right.
And we're trying to fix it up and put new flowers and plants, and the grass is being. We hired a lot of groundskeepers and stuff to keep the outside looking good, because it's a beautiful community, and we want to make sure that the hospital fits in the community and really adds to the community as far as being a nice facility as well.
Nice neighbor.
So what's the future of emergency medicine? What do you think? I know you just went to that conference, the ACEP conference, American College of Emergency Physicians up in Boston. So what came out of that? What did they talk about?
I talk about a lot of things. Interesting things are telemedicine, and also more with paramedic medicine.
Paramedicine?
I think those are paramedicine. Those are very interesting topics for me, where they bring medical care to the patient's home.
So in other words, instead of the doctor doing a house call, the paramedic would do a house call?
Paramedic can do house calls and patient with
then talk to
directions
you-
from the doctors.
doctor.
Yeah,
Interesting. That's an
Yeah.
interesting concept.
yeah.
That's a big paradigm shift to what's happening today, where the ambulance comes and picks you up and brings you to the
And
doctor.
brings you to the doctor,
Wow.
right?
So that's
or
just-
they bring the doctor to you,
Yeah.
right?
So this is still in
Right.
its
Infancy, I
infancy.
think, but
Good.
I
That
think
sounds
there's
like the
some talk
future.
with
Sounds
that.
like the future that is going to be really interesting. I know, emergency rooms, the visits are still there. We're still very, very busy. Thank God we have a very big emergency room, so we always have room to expand. I don't think we've ever gone on what they call diversion, unless there was something physically going on at the
Sure,
hospital
sure.
at that particular moment.
Sure.
But we always have plenty of room. It's a big hospital and a big emergency department. So there's always a room, and there's always a bed, so no one's really waiting for a
No.
bed or waiting out in the waiting room.
No.
I know you guys pride yourself on seeing a patient, and as soon as they enter the waiting room, get them in a bed.
Right.
You don't want them waiting in a waiting room.
No, we don't. So
So you get them, bring them right in, and the doc sees them, and hopefully make their, hopefully it's an enjoyable stay, and we get them out all
right, our
going
goal. Right, our goal is to have the patient see the doctor within 15 minutes to half an hour.
So in and
So
out. Get them
yeah.
in, see the doctor, get their prescription or whatever they need, if in fact that's what they need, and get them out.
right.
I mean, that's something people don't ever. No one likes going to a hospital. I mean, hospitals are never associated with being a good thing. Unless you're having a baby, then maybe
True.
it's good, right?
True.
Otherwise, going to the emergency room is never a happy experience. I mean, for anybody who doesn't, we don't want to be there. So
Right.
anything that we can do to make that a little more pleasant, I think we're trying to do. So, well, Dr.
Very
Ting,
nice.
I want to thank you very, very much for being here. You really bring a lot to that emergency department, and it is a great department. Dr. Booten, who's the chairman, really runs a great department. Dr. Kristen Kumar, who's the pediatric director for
Right.
pediatrics, who's a really amazing pediatrician, does a great job with the peds. They decorated it all up with all sorts of pediatric stuff
Yeah,
on
it's
the wall.
very nice,
Yeah.
very pediatric friendly,
Yeah,
right?
it really-
Children friendly.
Yeah, and it's completely separate from the ED, so there's no mixing of the adults and the kids. It's all
Sure.
completely separate, which is really helpful. And the waiting room is nice as well. Now they get the big revolving door in the front.
Yeah.
Keeps out the cold and the heat.
Yes.
All right,
Right.
Dr. Ting, I want to thank you very much for being here. I'm Dr. Victor Politi. I'm the
Thanks for
president and the
having
CEO of Nassau University Medical Center over on Hempstead Turnpike. We're always going to be here for you. no matter what ails you, whatever emergency is, or if you just need to see a doctor or anything that is healthcare related, we have it. And we appreciate you listening in to us today and to giving us a chance to let you know that Nassau University Medical Center is really coming around to being one of the finest hospitals in Nassau County. So again, enjoy your day. I'm Dr. Vic Politi saying goodbye.